David, I'll be back with some more headlines later, but back to you.
Helen, thank you very much for that. One of the budget measures the Abbott government is struggling to get through Parliament is the $7 GP co-payment that it proposed on budget night. Labor, the Greens, the Palmer United Party all oppose this idea. Well, today the Prime Minister met with the President of the Australian Medical Association to discuss this. The government would love to have the AMA on board here. The AMA does not support this specific proposal. And coming out of those talks, Professor Brian Allen, the President of the AMA, suggested that the Prime Minister had told him that he was prepared to consider other models. As we heard the Prime Minister say in question time, he remains committed to a $7 GP co-payment. So where does this leave things? Professor Allen joins me now. Thank you for your time.
That's a pleasure.
So to clear this up, did the Prime Minister tell you today he was prepared to consider a different way on this GP co-payment?
Yeah, the meeting today with the Prime Minister and the Minister for Health was a very constructive meeting. We outlined our concerns about vulnerable patients and as well as the impact for our own members, for doctors, about this particular proposal. The AMA has always said that it supports some forms of co-payment and many of our doctors already charge it. The Prime Minister suggested to us that we work with him and the Minister in coming up with an alternative model, and he was willing to look at other models which achieve the government's objectives.
So what are some of those models then?
Well, one of the things they want to do is try and send a signal in terms of the cost of the GP service. So actually having some form of co-payment to deter unnecessary visits to the doctor. Now, I would suggest to you that there are not too many of those unnecessary visits that actually do take place, but we understand they want to have a model that puts greater value on general practice, and certainly many of our practitioners want to see a greater value put on general practice.
Well, there was that, but the other aim is to raise money for a medical research fund.
Yeah.
How wedded are they to that?
Well, as I said to the Prime Minister today, we can't support a model in which there's such a cut to the Medicare rebate. I mean, we already have GP services which are undervalued. They're certainly worth more than the $36 rebate that they currently get. So having a $5 cut to that rebate to the AMA and to our members is unacceptable. I understand they've linked it to medical research funding and the Medical Research Future Fund. That's a problem, obviously, that the government's going to have to deal with. But as someone who's done research and understands the need to get more money into research, and the AMA certainly wants to get more money into medical research, look, I can't support something that takes money out of primary health care and puts it into tertiary level research.
And what was your sense of their position on that?
Well, that's something they're going to have to look at, and the Prime Minister did say that they're willing to look at those issues. If they want to fund a Medical Research Future Fund, and I do hope they fund such a fund, they're going to have to look at alternative ways of raising that revenue.
So let me ask you this. Is it possible to have a co-payment that is softened by exempting children, the chronically ill, pensioners? Would that be something that you'd look at?
That's right. So our concerns around the co-payment are protecting those that are most vulnerable, those that truly cannot afford to pay co-payments, and supporting some of the policies that we have in promoting better health. So things like preventative health care, encouraging things like vaccination, but also making sure that when people get a chronic disease, that they're properly looked after and they're not punished for having that illness. So where people can afford to pay a form of co-payment, they should be privately billed. They should contribute to the cost of their health service, and certainly the value of the service that GPs provide is worth more than the bulk billing rate now.
From what you've said there, that those who can afford to, would the best way to go here be to means test it and say only those above a certain income pay this fee?
Look, obviously there's going to be a range of things that we have to look at in terms of determining where the threshold is for those who should and should not pay some sort of co-payment. Now, there are many ways to look at that. I think we need to have some discretion for the doctor that doesn't punish the doctor in terms of accepting a much lower rebate when they do decide to bulk bill someone, but actually allows them that flexibility when they recognise particular circumstances for that patient that allows them to still receive a fair remuneration for the service they provide, but doesn't financially punish the patient as well.
And I suppose the problem with reducing the amount of the co-payment to $4 or something, it's not going to be that price signal that the government wants and that you agree with.
Well, that's right. So it has to be a reasonable amount. I mean, what the amount should be is something that we have to model, and that's the sort of modelling, unfortunately, that wasn't done before the budget, and the sort of modelling that we've given a commitment to work with the government on in terms of coming up with a solution that does protect vulnerable patients, supports general practitioners for the sort of services they provide, and does deliver the outcomes that the sort of outcomes the government is looking for.
If you can achieve all of that, just finally, if you can have, whether it's a $7 co-payment, means tested only to those who can afford to pay it, the bottom line is it going to get through? You have just come, as I understand, from a meeting with Bill Shorten as well. How open do you think Labor would be to backing that sort of idea?
Well, at the end of the day, that's going to be up to the proposal that we bring forward, and they'll have to assess it on its merits. But as far as the AMA is concerned, if there is an acceptable model that we think deals with our concerns and it delivers a better outcome for not only GPs but also patients in the Australian healthcare system, that's something that we will support the government with in the future.
Professor Brian Owler, AMA President, thank you very much for joining us this afternoon.
Pleasure. Thank you.
Take a break.